Uh, Before going to in this topic, I will highlight that we are Intero Germina team, and most of you already know the Intero Germina because we are promoting this since 2012. We are already number one in Pakistan among Intero Germina population, and at this moment, it is mostly being prescribed by the pediatricians. Even in other specialties, there is some marks as well. But on the other hand, if we talk about the gut population in the adult population and the gut health, we have started this segment recently, and we have bring a new SKU in our portfolio, Enterogermina 4B. That's why we are conducting these programs in further topic of and gut microbiota and gut health, especially in the adult populations. And I am today accompanied with my colleague Dr. Ufak Zara. She is a senior medical expert in our team, and she is based at Karachi at head office. I will request Dr. Ufak Zara to please proceed with this today's session.
Thank you. Thank you so much, Murtaza, for a good context in order to make our talk palatable. So I welcome all our healthcare professionals, our doctors in this medical education program. And today we would like to talk about the role of gut microbiota and the overall gut health, because we understand the management of generally diarrhea and GI disorder are a little bit different when it comes to the pediatric population and when we address these clinical issues in our adult population. So let me share with you a thought about human microbiota. For many of us as a medical doctors, as physicians, we understand that the human body is full of normal commensal and full of microorganisms, but gut is considered as the home for these microbiota. Gut has its own importance because it is considered to be the second brain of the human body. It controls most of the human activities with the help of these microbiota. There's a very popular terminology of a crosstalk that we have been hearing for a long period of time, that your body speak to you. And this is with the help of these microbiota. These microbiota are the living organisms, and we are inhabiting them as a second organisms in our body. So our bodies speak to them, and they speak to us with the help of the chemical messages. If you just evaluate the number of the amount of the RNA or the chromosomes that human body has, with the help of these microorganisms, it actually becomes the double. So we, as a human organisms, we carry almost double the amount of chromosomes because of these microorganisms. There are millions of such microbial genes, and they all are inhabited in our gut, and they get connected to our brain and all physiologically to all other organs of the body with the help of chemical mediators. And these are this is what the overall structure or an infrastructure where these organisms based. But what benefit they provide us, these are innumerable, that I'll be telling you a little bit more. So so we just need to take out of take our brain out of the rigid placement of microorganisms, because these are present in GI, and because they are immunologically, they are communicating to all organs of the body. There are many functions in the urogenital system. There are many functions at the airway, in the skin, and in our oral cavity. They are present, and they transmit their messages with the help of chemical mediators. So how these gut microorganisms, they carry beneficial properties to us as our the host, or providing them the place to live. They actually help us to maintain the overall mucosal barrier, because we understand that mucosa is one of the first line defense. This is the era of being strong in our defense and immune system. You know, after these warfares, now immunity is the second most important weapon this time everybody is seeking for. So the first line of defense for any kind of infection is the mucosal barrier. Mucosa, whenever there is a breach in mucosa, whenever there is an incision in mucosa, infection can very easily get inside the human body. So mucosal barrier is very important, whether it is inside the organ or whether it is outside the body in the form of a skin. So many times these microorganisms, they stay on the surface of the mucosa, and they create a very tight junctions that it is very difficult for any other organism and harmful agent to get into the mucosa. Second, they provide so many nutrients in the form of vitamins, some of the essential amino acids that our body cannot produce, and we often do not take them in our food as well. So these microorganisms, they work as a factory. Whatever nutritional elements we eat, they utilize those nutrients and produce those amino acids with the help of the enzymes they have in their body. These microorganisms has a very unique way of communicating our immune system. They have the body extensions. These body extensions on the surface of mucosa actually interact with the human blood. And whenever they contact with the human blood, they continue to give a signal of a normal bacterial structure. And because of the signal of the the normal bacterial structure, it continue to produce immunoglobulins, particularly IgGs. So whenever these bacteria, they colonize, they have the ability to ferment. I hope that we all understand the fermentation, and this fermentation actually helps in producing complex carbohydrates. With the help of these complex carbohydrates, many metabolites produces, including short chain fatty acids, essential amino acids, osmolar nutrients, and the electrolytes. These major elements help in the gut motility, and they balance the osmolar pressure of the gut inside and outside the enterocytes. In summer, even without taking any bad food, sometimes we experience diarrhea. It is because of the same mechanism. When the human microbiota is not in order and it gets imbalanced, this osmolar balance gets disturbed, and because of this osmolar balance imbalance of the osmolarity of enterocytes, it leads to the simple plain watery diarrhea. This is one of the very common phenomena in summer. So a very basic of what probiotic do and how they help us in maintaining the gut health and the gut motility. A new phenomena has been actually new in a way that it has been renamed. It used to be gut-brain axis. Now it has been renamed as gut-brain enteric microbiota axis, because now this is a bi-directional communication with the help of chemical mediator, whatever our immune system, whatever our GI, central nervous system, and the parasympathetic nervous system, they receive messages from the GIT, and from GIT, the major signals has been produced by gut microbiota. There are species of gut bacteria from one species to another. It varies. There are certain species which actually exert a very strong influence, and certain species are very specific to only motility related things. So it is important in general that the probiotic has been taken, whatever probiotic has been given to the patient must have strong strains in order to influence the overall gut functions. But with the help of the recent studies, it has been analyzed that this process of symbiosis is actually occurring because our whatever information gut microbiota is communicating, it is to be sent to the central nervous system, and then central nervous system respond accordingly, or the vagal response is according to the gut microbiota, the amount of the gut microbiota, the chemical mediators produced by the gut microbiota, and the motility related issues or the pressure which is produced and exerted by the gut microbiota, CNS work accordingly. So there are multiple clinical studies has been done for the gut health, and we understand that this is whatever a child is produced and the adult live in the kind of environment, it changes the overall colony of the gut microbiota or the microorganism of the gut. Genetically, we all vary. Even living in the same situation, one individual has a different microorganism and another has a different microorganism because genetically it is designed. Then we have right now we are living in the edge where there are so many cesarean sections going on. So there is a very big difference of a child being delivered spontaneously vaginal delivery through SPD or through cesarean section. It also makes a lot of difference in the overall the microorganism of the GIT. Then how the person has traveled from one destination to another, what kind of food somebody has taken, what kind of job somebody is doing, what for example, if it is like a lot of stress, it actually create a lot of nicotine inside the gut, and that makes gut microbiota difficult to survive. So in a stressful condition, our gut microbiota may not be in that good state of in that active state to exert their physiological function. Then what kind of eating habit somebody has developed. So all these all these factors affect the overall colony or the diversity of the microorganism in the gut. A part of it, even it varies from one age to another. Like, for example, a child has a different microorganism, then certain hormonal changes occur, and then it changes from one kind of microbiota to another. There are certain metabolic parameters, growth factors, what kind of immunity somebody exposed to. If somebody is exposed to so many pathogenic, environment where there are so many pathogens, of course, it has a different kind of bacteria. And when his bacteria interact with a low immune or a kind of an immunocompromised person, of course, it will be difficult for him. So it varies from one place to another. It also some way give us an answer of this current COVID situation, that there are similar geography and similar people living in the same home, but some have that kind of immunity to fight against this coronavirus, but other would get affected even living in the same home. It's the same reason, because everybody has a different metabolic parameter, has a different kind of neurotransmitter, have a different state of immunity. Their microorganism, their bacteria inside the gut are even some people have very strong, some people do not have that strong. So with this variation of microorganism, there are a cascade of diseases that somebody could develop with the passage of time. And this is not a one-day disease or an acute inflammation, but it is over the period of time somebody would be developing these long-term diseases like asthma, obesity, pain, arthritis, psoriasis, Alzheimer, multiple sclerosis, could be GERD, diabetes, coronary heart disease, and it could be any mutagenic and cancerous condition. So we understand that we are exposed to so many such things like antibiotic, like oral contraceptives, chemotherapy, steroids, um, uh, such dietary things that is not good for our health, alcohol, heavy metal. Many times, recurrent H. pylori infection is very common, is stress, and many surgical interventions like for example, endoscopy. So all these things actually affect a lot to our gut microbiota. And whenever there is a structural change in the bacteria, whenever there is an effect in the colony of the bacteria, I mean the amount of the microorganism, and whenever there is a difference in the species or strains of the bacteria, this causes dysbiosis. Disordered biological organisms of the gut is known as dysbiosis. And this dysbiosis leads to all these diseases that I just mentioned to you a bit before. So according to the World Health Organization, one can take living microorganism, but in a very good amount. This they call as an adequate amount. And this adequate amount is like the minimum is amount 2 billion, for example, for some kind of probiotic. It could be 7,000 colony forming units. It could be 4,000 colony forming units. I just want you to understand that this is not 15 milligram, 25 milligram, or 60 milligram thing. It is a very, very big amount of living organisms, or their antigenicity would remain intact, or their pathogenicity is being eradicated, and then they entered in the human body. They must have the capability to pass through the tough environment of the stomach and a small intestine, and get bedded in the large intestine, and there they would be producing their symbiotic effect and the synergistic effects. At the same time, a good food that has the capability of fermentation, like dairy food, like green vegetables, less sugar diet, they all work as a prebiotic. So if the prebiotic is accompanied with the probiotic, it produces a synergistic effect. Now, one of the most important area, because we belong to the community where antibiotic has to be used in conditions, because secondary bacterial infection or the susceptibility of developing secondary bacterial infection is very common. So even with the viral infection, we understand if the patient is coming with multiple time recurrence of the viral infection, or for instance, if it is refractory infection, it is not getting treated completely and coming again and again, one has to start the antibiotic at any point in time. And with a lot of antibiotic, the very common side effect is the diarrhea, and almost 35% of our patients develop antibiotic associated diarrhea at any point in time, sometime in the first type of therapy, sometime in the second type of therapy. So we have one of these study where Bacillus clozy has been used, and for 5 to 7 days, and it's a study being carried out in children where oral dehydration, zinc, and antibiotic, in the children where antibiotic associated diarrhea was there, about 13.6%, and then they were administered Bacillus clozy, and results said that we were able to reduce almost a day of the severe diarrhea. Uh, the diarrhea being resolved after the third day of the treatment. We were able to reduce almost 10% of the hospitalization rate, and about 81.6% patients just had, relieved with the loose stools. So Bacillus clozy, because it is one of the multiple strain and probiotic, it has very effective and a very strong result. Number one. Number two, it is a spore forming probiotic. So it has a lot of potential to pass very easily the tough environment of stomach and small intestine. And then since it is a spore form, when it gets bedded in the large intestine, it changes into its active form, and then make a big colony. Now, when it comes to the antibiotic-associated diarrhea in adult population, one of the most commonest indication is the use of antibiotic in order to eradicate the Helicobacter pylori infection, which is the cause of gastric ulcer or gastritis. And we understand it is also one of the commonest condition in our adults, and for that, we do a lot of surgical interventions like endoscopy. We need to put our patient for multiple time in his lifetime on chemotherapy. Multiple antibiotic regime has been used, and that actually results into dysbiosis, that result in the changes in the type of the microorganism and gut microbiota. The normal microbiota activity it is evident that it get hampered. So in that point in time, if the Bacillus clozy or the probiotic being used in concomitantly, and it is advised to continue to use in probiotic 2 weeks, even after completing the therapy of H. pylori with antibiotic. So you can get the benefit of resuming the normal gut microbiota again. So it has been seen that almost 30% of such patients relieved in their diarrhea. 65% of patients got relief in their epigastric pain, and almost half of the patient, 50% of them, has a better effect, and they were able to control the effects of nausea. So one of the very beneficial effect of adding Bacillus krausi in H. pylori eradication, I would like to make it clear that it is not used in order to eradicate H. pylori, but in order to overcome the effects of the chemotherapy and the use of antibiotic probiotic being used. So the take-home message for us is we understand and we know it so well that human body is inhabited by at least 10 times more bacteria than the overall human cells present in our body. And our gut microbiota are responsible for the overall immune regulation, for our first line of defense, and for the production of very essential elements that we are not able to take through our food. So it's good to have one of the diverse microbiota in our gut, the strongest action, good bacteria that can make colony. Those who are active enough to ferment in order to produce short chain fatty acids and osmolar electrolytes, and by this way we can regulate the gut motility, number one, gut absorption, number two, and we can reduce the chances of dysbiosis. There are certain bodies like World Gastric Organization and ESPGHAN. They also advocate for the use of the probiotic in the prevention of antibiotic associated diarrhea. And with this, I would like to thank you so much for your patience listening, and I'm hopeful that we are able to convey our message to you. If there is any question, it is more than welcome. We can have question at the moment. We can have question even with the help of our medical representative when they come to you. But our message is to use probiotic, particularly in antibiotic-associated diarrhea and in the population which are 18 plus 18 years and above, because it is equally effective and equally safe, especially in the SKU of 4 billion, because you really need to have a very good amount of
डॉक्टर उफक थैंक यू वेरी मच। आप डेफिनेटली आप काफ़ी आज नई चीज़ें हमारे साथ शेयर की हैं। पहले हम यूजुअली अपनी प्रेजेंटेशन में ये डेटा नहीं शेयर करते थे। अच्छा, मुझे एक यूजुअली जो हमारे लोगों को सवाल पूछा जाता है जब फील्ड में भी जाते हैं, तो उसमें जो आप कह सकते हैं ना कि जो सबसे सवाल एक तरह से कह सकते हैं कि जो ज़्यादा ज़हन में आ रहा होता है कि हमारे पास पहले 2B अवेलेबल था और 2B हम देते थे, फिर उसके बाद अब 4B आ गया। इंटरनेशनली तो शायद 6B और 12B भी अवेलेबल होगा, लेकिन क्या वो मिनिमम अमाउंट क्या है जो वो पेशेंट के लिए सेफ होगी, जिससे कोई प्रॉब्लम नहीं होगा?
मिनिमम अमाउंट इज 2 बिलियन।
उससे नीचे तो वैसे ही कोई मेरे ख्याल में थेरेप्यूटिक
Exactly.
इफेक्ट भी नहीं मिलेंगे।
Yeah.
और उससे अगर ऊपर देते हैं तो मैक्सिमम क्वांटिटी में कितना दिया जा सकता है उसको?
मैक्सिमम क्वांटिटी जो है वो है आपकी कि आप एक दिन के अंदर इसको 6 बिलियन तक यूज कर सकते हैं। मतलब आप 2 बिलियन की 3 डोजेस कर सकते हैं। 4 बिलियन एंड 6 बिलियन एक दफा है आपका, लेकिन आप 6 बिलियन तक इसको लेकर जा सकते हैं दिन में एक दफा। ये दिन की मैं आपको 1 डे की रिकमेंडेशन बता रही हूँ। लेकिन अगर आप इसका यूज फॉर हाउ लॉन्ग पूछे तो जो रिकमेंडेशन है वो 14 डेज का है, in order to restore the gut microbiota in conditions like जैसे surgical conditions होती हैं for ulcerative colitis and Crohn's disease, उनमें up to 3 months in studies it has shown result.
जी बिल्कुल, थैंक यू। अच्छा, इसी तरह से हम समटाइम एंडोस्कोपीज भी देख रहे होते हैं और उस पे लोग वहाँ पे भी यूज कर रहे होते हैं प्रोबायोटिक्स में, तो वहाँ पे भी हमें क्या इसको जिस तरह ये स्मॉल सर्जिकल प्रोसीजर्स हैं या इवन के लेप्रोटमीज हैं, उससे भी इसके ऊपर कोई इफेक्ट पड़ता है गट
बिल्कुल
माइक्रोबायोटा के ऊपर? उसमें भी कोई यूज करने की जरूरत पड़ती
इन जनरल जितनी भी सर्जिकल इंटरवेंशंस होती हैं जिसमें जो कि गट के लिए होती हैं, जो डायग्नोस्टिक नेचर की हैं, जिनमें पर्टिकुलरली एंडोस्कोपीज हैं
अच्छी तो एक
या
लेक्चर से
फ्लोरोस्कोपीज हैं।
बार-बार ਉਹਦਾ ਵਿੱਚ ਮੈਸੇਜ ਆ ਰਿਹਾ ਸੀ।
तो in those conditions आप प्रोबायोटिक इस्तेमाल करते हैं, और प्रोबायोटिक का इस्तेमाल करने की वजह ये नहीं कि खुदा न खास्ता कि उन डायग्नोस्टिक इंटरवेंशन के अंदर कोई ऐसी इस तरह की कोई सिचुएशन बिल्ड हो जाती है और आपको जरूरत पड़ेगी। इट ओनली हेल्प्स गट टू रीस्टोर द प्रीवियस बेटर माइक्रो ऑर्गेनिजम्स जो कि इस प्रोसीजर की वजह से जो है वो या तो निकल जाते हैं या खराब हो जाते हैं, या उनकी क्वांटिटी मिनिमम हो जाती है। सिचुएशन इज दैट कि जब कभी भी ये माइक्रो ऑर्गेनिज्म लो क्वांटिटी के अंदर रह जाते हैं गट के अंदर, तो ये कॉलोनीज बनाने में नाकाम हो जाते हैं। वंस दे डू नॉट मेक बिगर कॉलोनीज, दे वोंट बी एबल टू एक्सर्ट देयर फिजियोलॉजिकल इफेक्ट।
जी, थैंक यू। डॉक्टर उफक, इसी तरह से आजकल रमज़ान का महीना है और रमज़ान में जो डाइट पैटर्न है वो हमारा काफ़ी चेंज हो जाता है। जो रूटीन में हम यूज़ कर रहे होते हैं वो आजकल में शायद हम बिल्कुल ही अपना और तरह से बिहेवियर शुरू कर देते हैं। तो उसके हवाले से कुछ बताएंगे कि उसमें जो डाइट पैटर्न चेंज होता है तो वहाँ पे फिर क्या गट माइक्रोबायोटा भी चेंज होता होगा? क्या वहाँ पे भी हमें ज़रूरत पड़ती है?
सबसे इम्पोर्टेंटली तो इसलिए मेरे ख्याल से रमजान से पहले जितने भी डाइटरी सेशंस हुए हमारे हेल्थ केयर प्रोफेशनल्स के लिए, सब में बैलेंस डाइट की बात हुई कि आप अच्छी डाइट इस्तेमाल कीजिए, फ्रूट्स यूज कीजिए। मतलब इन शॉर्ट ये बोला गया कि आप अच्छे प्रीबायोटिक्स इस्तेमाल कीजिए तो दैट आपकी जीआईटी जो है वो डिसऑर्डर्ड ना हो। लेकिन इफ प्रिवेंटिव तो खैर बहुत ज्यादा नहीं, लेकिन इन केस के अगर आपको लगता है कि यू हैव बीन using high fat diet or high acid diet, high sugar diet, and less of the fiber related stuff. So there you can supplement the probiotic because of course high sugar, high fat, and high acidity related dietary agents affect the gut microorganism. It takes gut microorganisms away, and your gut is vulnerable to develop any kind of infection.
आप अनम्यूट करके भी
अस्सलाम वालेकुम।
अस्सलाम वालेकुम डॉक्टर अल्ताफ, कैसे हैं आप?
ठीक है, आपका क्या हाल है?
बिल्कुल अल्हम्दुलिल्लाह, अल्लाह का शुक्र है।
सॉरी, मैं एक्चुअली मेरी एक बाहर से कॉल आ गई थी ओवरसीज यूके से, तो वो लंबी होगी। एक पेशेंट के बारे में शुरू में जान नहीं कर सका।
नो इट्स ओके। हम आप वैसे भी हमारे साथ अक्सर ही होते हैं, तो हमने डॉक्टर साहब वही सारी पुरानी बातें की हैं, लेकिन थोड़ा सा पर्सपेक्टिव डिफरेंट था, रमजान के हवाले से था।
हाँ जी, एंटेरोजमिना तो हम यूज करते रहते हैं ऑलमोस्ट डेली बेसिस पे। कोई ना कोई पेशेंट आते हैं जिनमें, और बड़े अच्छे रिजल्ट हैं उसके। हम मोस्टली पेशेंट्स में यूज करते हैं जिनको ये एक्यूट डायरिया या और भी जो भी उसकी इंडिकेशन है, हम यूज करते रहते हैं इसको।
थैंक यू सो मच सर।
थैंक यू सो मच सर। थैंक यू फॉर शेयरिंग योर एक्सपीरियंस सर।